Hello viewer, welcome to today's discussion. We're so grateful. This is Look Up TV, and today we are focusing on 15 counties with the rise of new HIV infections. And in studio today we have Mr. David Ochola, who is a peer educator, who is going to tell us more on this and much more on HIV. My name is Jupiter Mayaka on Look Up TV on the Bottom Line Kenya. Karibu sana, Mr. David Ochola.
Thank you so much, I appreciate it.
Yes. Yeah. So there has been the new infections in 15 counties. What is the problem? What is it?
I think the main cause of this rise of HIV is about the corona, the COVID-19 issue. Because if you understand very well, most of our focus on COVID-19, and we forget about HIV. And that's what the reason why the rise in HIV in 15 counties has rise. And if you look very careful, most of young people and adolescents were not in school. So the first thing, they were idle, and so many people they engage in sexual intercourse without preventive measure, protection, anything. And you know, at this period of corona or COVID-19, parents were up and down looking for money to put into the table, so they didn't have a lot of time to be with their children, talk about sex education and in any other thing here. And that's what the reason why the rise has increased in the 15 counties.
So do you think like COVID-19 has really impacted HIV in terms of, if in case like COVID-19 is contained, the HIV infections will go down?
For sure, because the first thing you need to understand, when the COVID-19 came into our country, there were so many people lost their jobs. So many young people, they didn't have job, so they were desperate. In the process of being desperate, the others were engaging in transaction sex, others they got into early marriages, others because they didn't have another option. But they saw the only option to end my problems, my challenges, is to getting into early marriages, in transaction sex. That they saw that is the only way to get out of this big issue and the problem they have.
Okay.
Yeah.
So the 15 counties include Marsabit, there is Narok and such. But in earlier on, the main focus was in Nyanza. So does it mean that the focus was shifted because there was so much focus in Nyanza, then now these other counties were left behind?
For sure, because you know the matters of about HIV, if they saw there's a high rate of HIV in a certain place, they focus their mind, their resources, and everything in those places to ensure that the HIV infection is controlled. So now you see there's a spread of other 15 counties where they were not focusing on. So you know, when HIV, they focus only on a specific target. When they see it's about Nyanza County, there's a high rate of HIV. Their resources, their labor and everything, they'll focus on those sites. Yeah.
Okay, thank you, Mr. David. Okay. As a peer educator, there was COVID-19 that began in March last year.
Okay.
What exactly have you done? Because there was restriction of movement and contact with people. So how are you able to sensitize people more, especially the adolescents who are at home, on the matter of HIV?
We have a WhatsApp group which we focus mostly on people living HIV.
Okay.
Where we give them awareness, reminding them of taking their medication in time and everything. And also we have a movement called Youth Gravy Initiative. It is in Facebook. We try to give awareness about HIV, about PrEP, about GPV, and about drug abuse and alcohol, and about contraceptives. Yeah.
Talking of PrEP and PEPs, maybe there's someone who want to understand more on the PrEP and PEPs. Can you expound more further on it, and has it been effective so far since the introduction in 2017 in Kenya?
It has been effective, most probably for those discontent couple. One partner is negative, another partner is positive. It really impacted them so much, because you will get there's a partner who is tested and is less than 6 months in medication. So when each partner take those medications, they really help. Another thing about PrEP and PEP, you know, PEP is PrEP is pre-exposure prophylaxis, where you take after you expose yourself
Before PrEP.
before you expose yourself to HIV. So that is mostly focused on people who are discordant couple, those who do transactional sex, those sex workers and everybody. And then PrEP is after you have exposed yourself to HIV, and those mostly focus on those people who are injecting themselves, those drug users, those transactional sex workers, and another thing, those people who there are ongoing risk of HIV. Those are the people who can use the PrEP and the PrEP.
Okay.
Yeah.
So does it mean that if, for example, I am not in marriage, that I am not supposed to use PrEP?
No.
Is it meant for people who are in marriage, as a couple?
No. Those people who are at a high risk of infection,
Okay.
they are available to use them. Yeah.
Okay, you've gone through, you've done HIV testing services. I want to talk about the self-test kit that was introduced on board. How effective has it been?
It has really benefited the people out there, because like people like men, they're not people very easily to get to the facility or to the hospital to get tested. But when they introduce this self-test kit, there are so many positive impact that are brought in their lives, because you find when somebody wants to test, you can test it at home and give feedback. And when somebody is tested positive, there's a code or a SMS or a number you can call, and they give you a direction and way to do it.
Maybe if you might expound further, if I purchase this self-test kit, how do I use it?
First, there's a process. It's written in the
instructions.
Yeah,
Okay.
you used it. Yeah.
Okay.
Because there's a oral quick. It's only can use within 20 minutes, and it's not about removing of blood. It's all about you through your mouth, and it gives a result for 20 minutes. There's no any blood there. Yeah.
Now, in this report by the Ministry of Health, it says that men are likely to die from HIV infections. Why?
Because men, the first thing, they don't like to go and test up HIV, their status. Another thing, they don't like to start medication, and that's why they say there's a high chance of those men dying, because when these men get tested, they are very hard to start medication, because they say they are healthy, they have no sickness anywhere though, so it's very hard for them to go to the hospital to start medication. So what happened, they wait until the last stage of HIV, where opportunistic infection has attacked their body. That's the time they realize, oh, I'm so sick, let me go to the hospital. That's the reason. There are two reasons. They are very hard to go to the hospital to get tested. Another thing, to start medication. That's the main reason behind why there will be more men dying because of it.
Maybe what kind of strategy could be used, like to lure this men, not lure really, but to make this men go to the hospital to be tested, so that we can really reduce the number of infections and deaths that come with HIV/AIDS?
What can really help is to, for example, male champion, they recruit about male champion who are living with HIV, just to show this, to give these people encouragement, telling them, you know what, you're not alone, we are here, we are living positively, we are taking our medication, and we are well. So that's the only way to go about it, to recruit men who are living with HIV, so that other men can see them, know, oh, I'm not alone in this journey, I have so many people who are living with it. Yeah.
Okay.
And bring another thing to educate these people the importance of HIV, the consequences of not starting medication, and in the society, when you empower the society, they will be informed. They know, this, I need to do this, I need to go this, for me to not to die, or for me not to reach to the last stage, I need to take my medication well.
Okay.
Yeah.
So, like, if men don't get tested, or they're not likely to go to the hospital to get tested, then that means they might be HIV positive and they don't know. That means that is a discordant couple. One is infected and the other one is infected. As a peer educator, and you've been maybe to places and informing people about HIV, sensitizing and giving awareness, what can be done? I mean, is it really like the couple? How will they get to know? Or how will the one who has be told, like, you can still talk to your partner and your partner about this stigma? There won't be stigma or discrimination in the process.
So what we do is something called PNS, Partner Notification Services, whereby if one partner, it's very hard to disclose to his or her partner about his status, there's a way we do it for them to come for testing. After coming for testing, that is a process where we start counseling those two people. Or what we do, a partner, if you're HIV positive and your another partner is HIV negative, and you fear of being left or being dumped. So what happened? You come as a new. You don't know your status. So when you are in the process of being tested, you are counseled together and you start medication. It's like now they counseling together as a couple, to avoid stigma and discrimination and any myth about HIV. Yeah.
If I've not done self-testing and I haven't gone to the hospital, how long should one wait to be tested after exposure?
After exposure, it's within 72 hours.
72 hours.
Yeah.
Okay.
And another thing, if you know the status of your partner. For example, if you know your partner is HIV positive, or you don't know your status of your partner, it's very advisable within 72 hours you visit a public hospital where you'll be get tested. After they probe and see you are eligible for PEP, then they will give you the PEP pills, just to prevent you from getting the HIV infection.
Okay.
Yeah.
Now, referring to still on the report that said, the age between 15 to 34 years of age, that's when there was high. That's how the infections came to be. So that means they were school-going children, or campus or university. And do you think sex education will help, or are we parents the ones who are supposed to talk to our children about the same thing so that we can help in curbing this epidemic?
It is both, because I feel there must be an introduction of sex education in both school and even as individual, as a parents. You have to initiate the sex education, because nowadays the media has corrupted our children. If you see the media of today, the song people sing in the media, the way people expose themselves, so they make that to see like sex is a daily thing. You can do it, you see. And the way people, nowadays young people say they don't fear HIV, they fear pregnancy. So they say, I rather get HIV than getting pregnancy, you see. So there's a need of sex education in school. And as a parent, you have to start initiating the sex education. Why? Because, when these young people grow up, it reach a point where it's called adolescent stage. You see, you as a parent, you haven't told this young child or young adolescent or daughter that, you are beautiful, you look smart, you see. Now, you're starting hearing this thing outside from a different people. You see, and the most of the time you see a boy or a girl telling another girl, you are beautiful. It's the first time hearing such things. So you see, oh, I find somebody who is loving me and everything. There are some words they must get from your parents. There are some words like sexual education. You have to start from your own house. Have a meeting with your children, talk to them about sex education and everything. Yeah, I really that thing will help to curb this HIV infection. And
in schools,
even
should it be part of the syllabus?
Yes, I advocate for that.
And from what age? Should we do it in primary, or we start in high school?
They should start from in primary, because adolescents start around 10 years and above. So my recommendation start from primary school to high school to campus. Yeah.
Okay.
Yeah.
Oh, that's nice.
Yeah.
Those are a few strategies that could really help.
Yeah.
Still on schools, is it cost effective that you can do screening for children in schools?
Can you repeat?
Will it be cost effective in your analysis? Will it be cost effective if you do screening for school children? Like the screening or the testing is done in schools?
Yeah, it's effective and it's low cost. But you know, the issue nowadays, what they do is they focus on PNS, partner notification services. Nowadays we don't test everyone. When one person is tested to be positive, now we look for their sexual partners. We follow on them, all of them. That's why nowadays where our HIV is going, they target only on PNS. On
you do like contact tracing for COVID-19.
Like that, yeah. So, but because of this high rise of HIV infection among youth, I recommend that there should be just a test for children who are in high school and primary. It will be a big help.
Okay.
Yeah.
A good conversation there. So there are 500,000 Kenyans who are sexually active, but they don't know their status. Do you think this one is also is a factor in spreading or creating the new infections?
Yeah.
And what can really be done?
Yeah.
Because you cannot force someone to go and test.
Yeah. It's a voluntary. And another thing about this thing, when someone doesn't know his status, and it's HIV positive, there's a spread of the infection. And another thing, before the HIV manifests itself to the body, it takes some time. It depends on the immunity of a person. So what I can recommend, at least within, if you know you are sexually active, go for a HIV test frequently, because that you understand that I'm HIV positive, and you make the right decision. Because the vision of 90 is to 90 people to be identified or to be tested, 90 people to start medication, and 90 people to achieve virus suppression. Virus suppression means when a person who has been tested for HIV positive to start medication within 6 months to achieve virus suppression. When one achieves virus suppression, it will be very hard to transmit to another partner, and that's how we'll cap this HIV infection. But when you see half of people doesn't know about their status, you see, there will be more infection because they haven't made the right decision. They don't know when I'm HIV negative, this is a precaution, I have to take this. When I'm HIV positive, this is the way to go about it. That's why you see, for us to cap this HIV infection, is for everyone's business to be our own keepers. If you find yourself, go and get tested. If you get your HIV positive, start medication. And if you're negative, there's a precaution which one takes to remain negative. Yeah.
You've talked about the 90% being tested and stuff. Where are we as a country?
As a country, we have tried a lot. And
because I get to understand, like, there are 14 countries who are there right now, like the 90. So where are the rest? Okay. Talking of Kenya.
About this 90. The issue here is all about that the last 90 of the viral suppression.
Okay.
Why? Because you get so many people, yes, starting medication, but they haven't achieved viral suppression. You see, now one person, or in a family, one person is positive, but he fears to tell his partner that, you know what, I'm HIV positive, let's go and get tested. You see, no, he's taking his medication, hiding. So he doesn't take his medication well. He skips and everything. So it is very, very hard to achieve the last 90% of the virus suppression. But we are trying our best. we are trying our best to make sure that the 1990 is achieved before 2030.
Okay, that's awesome. Thank you, Mr. David, for the insightful information about HIV. And we are focusing on the 15 counties that have the rise of new infections in Kenya. This is Look Up TV, and you can be sure to join us this conversation on our Twitter handle, which is Look Up TV. On YouTube is Look Up TV. On Facebook is Look-Up TV, and on our IG it's Look Up TV official. And you can also send us your SMS on 20374. My name is Jupiter Mayaka. Don't go away.
Kibera slum. It's different and the biggest of its kind in Africa. With people drawn from different backgrounds, all united in their quest to beat the odds and change their lives. Amid a grinding poverty and neglect, theirs is a life driven by hope for survival, engineered by 3 Ps: patience, passion, and perseverance. Join us on Look Up TV as we shine a light on Kibera's untold stories.
Toka abako kezia mpaka nitakapomaliza naye ndio utampata.
Mbona ninyi mkumbo wanyama pori mkaishi na wanyama wenzenu huko? Hebu nisaidie kufungua.
Toka hapa ni baya, amesema mtoke.
Toka, enda. Peleka huko. Tuondoleni hapa chawa na kunguni. Ulimtuma ushauri huo jipatie Canada. Waachana. Sasa hata hivi kuza wangu hautakia nini? Hata unarudi mpenzi.
Kiza Savimbi, I am taking this child to hospital. Ole wako. Niambiwe na anything wrong with her. Tajua mimi nani?
Nyinyi watu wawili mnashirikiana kupokonya watu mali zao, alafu mnakula mkinenepa tu. Aidha mkubali kurudisha mali za watu ama mkatae. Mimi mwenyewe najua vile nitazirudisha.
You're not a man, no. You're not a man, no. You're the God who opens doors no man can shut. You're not a man, no. You're not a man, no. You're the God of everything. There's no one like you.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands, or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the Government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Turn your 50 bob into a $1 million shilling investment. Changamka and Shindagari Chap Chap with Hometel. There's millions in shillings worth of prizes to be won. Send your 50 bob to paybill number 4040153 and get a chance to win 20,000 shillings daily. And each week, one person gets a chance to walk away with a Mazda Demio and another a Beth Mobility motorbike. Remember, the more times you try, you could be the winner of a fantastic Toyota Prado. Do not be left out. Send 50 shillings to paybill number 4040153, account name Look Up TV, and get yourself a Hometel lucky number. Changamka and Shindagari Chap Chap with Hometel promotion. For more information, visit www.shindagari.co.ke. Terms and conditions apply.
Welcome back. This is Look Up TV. We are focusing on the 15 counties with the new rise of new HIV infections. And today in studio we have Mr. David Ochola, who is giving us more insight on the same. Thank you, Karibu, once again. Welcome, Mr. David Ochola. We still on this topic, and we want to find out the solutions to a few of the things that we want to know. HIV was feared, was the #1 killer in Kenya, but these days, currently, it's not. Is it that people, there are some other diseases that have come on board that are taking away HIV, so people don't fear about HIV?
You know what happened? You know, long time or those days, there were not that much awareness into the society, but nowadays there's so much awareness about HIV in the society, and young people or people living with HIV, they're coming out strongly telling people, you know what, yes, we are taking our medication well, we are still living and we are living a happy life. So if they're making HIV to become a normal condition that people can live with it and enjoying life with it.
Okay.
Yeah.
So through the drugs, the ARVs, the therapy, what happens if today I start my therapy but I drop out on the way?
You know what happened about this HIV? It's so funny. You know, it's like a security, a security in a place. It's like a wall. And the moment this wall starts breaking, this HIV virus gets the point to multiply. At the moment, you know, this medicine, this medication, it is combination of 3 types of medicine in one drug. So what happened? It makes a wall to make this virus not to replicate or multiply in the body. So the moment you stop taking your medication, the wall starts breaking. It breaks. At the moment this virus gets the chance to multiply in the body and replicate. So you'll find that the more the virus in the body, your immunity will go down. At the moment your immunity goes down, the opportunistic infection will attack you eventually. So you'll find you'll reach a last stage. So many diseases will attack you. Even malaria, a very small diseases will attack you because your body doesn't have the strong immunity to fight those diseases.
Shortly before you talk about the replication process in a layman's language, briefly, I want to understand, after, if I stop taking my therapy, or if I stop being in therapy, is it worse than before? Before I started therapy?
Yeah, it will be worse. It will be worse. Because, you know, before you started the medication, there were the immunity, your soldiers in the body, they're still fighting this virus, you see. But now you have started the medication, the ARVs is fighting this virus to make it not to multiply in the body. So the moment it will be worse when you stop the medication, because there will be so many diseases will attack you. Yeah.
Oh, okay. Briefly, describe the replication process in a layman's language that even the oldest can understand what you're talking about.
Replication means, you know, in a very simple way, is when you take your medication or you don't take your medication, the virus in the body will start increase in the body. When it increases the body, the immunity goes down.
Yes.
At the moment it goes down, the virus will take over the body. So you'll not have the enough immunity soldiers in the body to fight the disease which is around.
Okay.
Yeah.
Oh.
Yeah.
All right.
So it means that's the increase of the virus in the body.
Okay.
Yeah.
Now, if I've started therapy, I'm doing my ARVs. Some people will tell you, I don't want to do the drugs. I want to do traditional herbs. In you educating people around on HIV and stuff, have you encountered such kind of scenarios, and what?
Yeah, we have encountered. And if you remember the Tanzania guy who was selling the herbal medicine, so many people who went there, even most of the clan, whom I attended, some of them lost their lives. Why? Because this HIV, you cannot mix this ARVs medicine, you cannot mix with traditional herbal medicines, because it weakens the power of the ARVs. So the moment you start mixing the ARVs with the herbal medicine, it's very dangerous. Even to make the ARVs don't work in the body.
Which means once you start your therapy, you're doing your ARVs, don't do any other medication that is going to, you think is going to help you
any
suppress.
herbal, even if it's to cleanse the blood, don't use any herbal medicine if you know you are HIV positive and you're under medication.
Okay.
Yeah.
Another question could be the population that is too high infected. And the issue of stigma and discrimination comes in, which is still a big barrier. It's really a big challenge still there.
For sure.
So, and you'll find even like some people, let's say a population, but there is that person who will say, I won't go to the hospital, or I won't be taking my medication from home because my husband or my wife will say me to take the medication. So what I'll do, maybe I'll go to the counter, I take my medication because that person knows me, and then I go home. But the other partner doesn't know. So how do we deal with that issue?
So what happened, we try our best to educate people living HIV, just to disclose to their partners about their status. Why? Because when they start hiding about their status, the first thing you have to be assured of yourself, he or she is not taking his medication well. Another thing, there will be no viral suppression, because the main issue of people living with HIV taking their medication daily and in time is to ensure that they achieve viral suppression. And when one achieves viral suppression, it's very hard for any opportunistic infection to attack him or her. So we always encourage people living HIV to disclose to their status to their partner, and we always encourage them, if you find it is hard to disclose, you come to the hospital or into the facility, we guide or tell him what to do about it here.
Yeah, I also still want to understand this stigma and discrimination, because probably is it something, you've worked with these people, you've talked to them. Is it, do they tell you that they're discriminated at work? Are we as a society, leaving them out of the main activities that we do, the jobs and everything, so that it's making it even for them to be, they shrink, they're in a corner, they're in a cocoon, that they cannot get out. And there has been sensitization on the same. But what else can be done? You as a peer, you've talked to these people, what else can be done so far?
It's just to empower the people about this HIV awareness. Another thing is to put a guideline on about workers, because you see many people who are working, it will be very hard to do, because the moment you disclose your status to your boss, that is the end of your working with that boss. So it's something that we need to put more effort on, because so many people they are facing stigma out there, even in school, in boarding school. It's very hard, because there's an incident I got. A young person who was in Form 2. So what happened, in the opening day of the school, there were inspection. So before you enter into the school, there's an inspection. So they found this bottle which has ARVs. So they tried to, this teacher said, what is this? Showing people around. Now this young person was stigmatized, discriminated. So what happened? People knew the bottle, they knew what the words was, so they went to Google and searched. What they found is for HIV, HIV people. So they started stigma and discrimination. So what we need to do is, even in the school, they should put more structure, which even if for inspection on anything, they know how to deal with those people living with HIV, to be more very careful and keen. Because the moment these people get stigma is the moment they don't take their medication, and it will be even worse if they don't take the medication. So what I can urge and encourage people out there, let us support these people living with HIV and show them love. What they need is only love and caring. And yeah.
What happens if, is it that we've gone more into, sensitizing those people who have HIV, and we've left the other side, which now makes even people who are living with HIV feel more, excluded from the society?
For sure. But, we need now to focus on those people even who are not positive. Just to give them awareness, telling them, what, these people, they are like us, you see. They are living a normal life like us. So the only thing they need is just love, caring, and everything. So what we need just to put more effort on is to just give more awareness to these people, to understand, what, these people are like us. There are no difference between them and us. Yeah.
The different strategies that are being put in place, one is behavior change. You as a peer educator, what have you done, is this behavior change going to help?
Yeah.
Are there steps that have been made on the same?
Yeah. We had a behavior change program and youth empowerment. It happened on January 2021. It happened in Umoja 2 at Manmin Church. It was around 120 youth attended the program, and it was under Smart Up organization. It's a movement of young people who are ready to change the society in any way. So those 120 youth, they really changed, and some people, they were asking, wow, we should have more program like this so that we can know and give self-discovering of ourselves, to know, what, because even as much as we are fighting HIV infection, we must begin with the behavior change, because if you don't make someone to change their behavior, it will end up to HIV infection. For example, someone as an addict of a drug abuse or alcohol, so even if he or she engage in sex, is not in sober, he doesn't know that this is the time I should wear a condom when I'm doing sex, because he doesn't know who is doing the sex with, you see. So he's not in a sober mind, knowing that, what,
he's intoxicated.
Yes, I have to do this before I do this, and what will end up getting HIV, you see. So there's so many things. Even if you get into drug, another thing, you will not have the money to buy these drugs. You'll end up doing transaction sex. Getting transaction sex, you'll get somebody who doesn't want to use condom, and you need the money to buy these drugs. You need this money. What will you do? Just go without condom. You'll end up getting HIV. So we need to focus, even as a country, as people, young people, as everyone. Let us focus on behavior change program, because when you focus on behavior change program, it will transform anything about HIV.
Okay.
Because when you change someone's behavior, it will lead to the other thing. Yeah.
Related to HIV/AIDS, there are other diseases, sexually transmitted diseases. When you're talking to them about HIV, do you also tell them, apart from HIV, there are also underlying diseases, other diseases that they can get when they engage in this? Yeah, we always tell them, and we always emphasize, because it has reached a point people are focusing only on HIV. Only HIV, yes.
Therefore, they're forgetting about the other sexual transmission diseases. They are there, and we always give them the priority. And we always, as much as we talk about HIV, we always talk about these other STIs. Yeah.
Okay.
Yeah, we always put the front line about them.
It's been, I think, over 30 years since HIV was in your first case in Kenya.
For sure, yeah.
How do we ensure that we get done with this HIV by 2030? I think that was the vision. In 2030, we are done with HIV. How do we get there?
For us to go to the end of this HIV, what I can say is everyone to be responsible, because HIV is everyone's business. If you go with that mindset, we'll end HIV. So that for us to end this HIV is for us to understand that HIV is everyone's business. If you're not infected, you are affected. So about stigma, let us don't stigmatize these people. Let us show them love and everything. If you don't know your status, go and get tested and know your HIV status. So what you can do as individuals is to all of us to take responsibility for ourselves and be our brother's keepers. If you know anyone who hasn't get tested, show them, give them the importance of HIV testing. Show them, you know what, if you get to be negative, these are the precautions you take. If you know you are positive, there are medication people take and they are living positively. So we must take this as everyone individual and everyone responsibility to end this HIV, because if we let HIV, we fight for those people living HIV and all mentors or the government, we cannot end this HIV. So it's for everyone to come in on board where you can, even in churches. Try and talk to young people about HIV. In mosque, talk about people living HIV. If you get even a small group of people, talk to them about HIV. Let the message be about HIV awareness. Wherever you go, talk about HIV, and I'm sure the next generation will be free of HIV infection.
Okay, thank you so much.
Yeah.
As we even wind up about COVID-19, and it has really taken back the gains that were made for HIV infections. So what is your goal as peer educators? I know you're not one, you're a group of people working together to achieve a certain goal. For 2021, what are you trying to do, at least to make this?
In 2021, we are planning to start a health tour across. We are starting within Nairobi County, and we are looking for partners to work with them. And we are going a health tour in schools, in churches, and in health facility, just to give awareness about HIV, PrEP, PEP, GPV, drug abuse, and contraceptives. So we are in 2021. We are meeting on March, that we can start our activity to go around and educate these people about HIV awareness and everything. Okay. So we are trying our best. Even we have a Facebook page known as Youth Creative Initiative, where we just give people awareness about HIV, about drug, about PrEP, about PEP, about everything. It's a big movement, and young people, let me tell you one thing, young people are ready to bring change to the society and to the community. Even as smart-up organizations, they are really trying their best to change the community and young people at large. So we are planning to have a health tour across. We are starting with Nairobi County. We are focusing on health facilities, schools, and churches. That's the place where we are targeting, just to empower these young people about HIV, about PrEP, about PEP, about drugs, about behavior change, anything that deals with youth and adolescents.
Okay. Do you think the way the focus has been on the 15 counties, do you think like now you're going to focus more on the 15 counties and leave out the rest of the counties, and then maybe next time you'll also find a report saying that this is a new infection from other different counties apart from the one that we have right now?
So what we need to do is just we cut across the country and focus, because what HIV have been done when they saw Nyanza as a high prevalence of HIV, they focus on Nyanza. So what I can advise or recommend is let us focus HIV across the country. Because when you continue focusing, now we are running for 15 counties, we are forgetting the other counties. The risings will not be doing anything good. So my recommendation is to just let us focus across the country and ensure all the counties are engaged about the HIV discussion.
You talked about having a group of peers who have come together, like the one that you had, 120 of them on board. What are the challenges that they're saying that is bringing on board this other stuff?
The most challenges they were talking about is about they don't have jobs. You see, they're idols. Their family cannot raise money for them. So they find most of them they're engaging in transactional sex. Most of them they are in drug just to keep away, don't remember their problems in their homes.
Okay.
Yeah.
All right. In 1 minute,
Yeah.
can you tell the viewer, send a message to the viewer, as we know.
What I can say to the viewers who are watching me, HIV is everyone's business. Let us, all of us, take HIV as awareness. Let us spread the message. Even if you spread to one person, let me tell you one thing, knowledge is power. When one person is being empowered about HIV, let me tell you, in one way or another, it will get about 15 people. The more I tell you, you tell another person, you tell another person. In a twinkle of an eye, people don't understand. You know what? There's an HIV here with us. So we need everyone to take HIV as his or her own business. So if we take this thing as our own business, we will end this HIV. Another thing, as much as we try to prevent COVID-19, let us not forget about HIV.
Okay.
So I'm encouraging young people and adolescents and people out there, as much as we are wearing our face mask, let's don't forget to wear our condoms. Thank you so much and be blessed.
Thank you so much for your insight.
Yeah.
That has been Look Up TV with the focus on 15 counties with the rise of new HIV infections, and we have had insight on the same. Thank you for watching. Be sure to join us on this conversation, and God bless. My name is Jupiter Mayaka.
We value your feedback and welcome your complaints about our programming and operations. Feel free to get in touch with us through 0700 893 542 or send us an email to views@look-up.com.